مساء الخير عليكم جميعا. معكم عبير صقر من هيوستن تكساس. اليوم بدنا نستضيف دكتور فيليب غاليغوس، طبيبنا الجدير بالمقابلة، دكتور أخصائي صحة عامة، ورح نتكلم عن نقل البلازما الشابة. نقل البلازما الشابة إلها مزايا وفوائد، وبدنا نتحدث معه بخصوصها ونفهم منه مزاياها ومساوئها إذا إلها مساوئ، ومين الناس اللي ممكن يستفيدوا منها. أهلا وسهلا فيكم كلكم، نورتونا وأنا مبسوطة كتير. خلينا نضيف معنا الدكتور، وأنا سعيدة بوجودكم معنا اليوم. خلينا إحنا نعزمه علشان يدخل معنا على الانترفيو هادي. دكتور غاليغوس، ثرايڤ ميديسن هو سنتر متخصص في العلاجات لتعزيز الصحة، وهذه مراكز حديثة رح تكون معنا ونتكلم فيها. أهلا. Hello Dr. Gallegos, how are you?
Hi, Beer. How are you doing?
I'm good. Thank you for joining us today.
Absolutely.
We are going to discuss today young blood plasma. That's
Correct.
we agreed on. We're gonna have a lot of questions for you, but we would like for you to introduce it to us at this time. So what is exactly the young blood plasma?
Yeah, just before we start, I'm joined by two guests.
All right.
So this is Mr. Tom Casey.
Hello.
He is the CEO of Spectrum Plasma, who provides the plasma for young plasma therapy, and he is also receiving therapy himself today. So we will discuss that. And this is Hanana Whittingham. She also will answer questions about young plasma. So we have a few different experts to be able to answer your questions. So
one of the questions is where are we getting this plasma from? So I guess the suppliers are right next to you.
Yes. Yes. So let's start with what is plasma in general. So plasma is a component of your blood. So you have red blood cells. The red blood cells have hemoglobin. They carry oxygen and nutrients to the body. You have plasma, which is the watery component, which is the gold component of the, as you can see up there. And that contains proteins, peptides, hormones, exosomes. So it contains all the messaging system of the blood to signal cells to do what they need to do. And then you have platelets, which are the components that help you clot. So if you get injured or you have surgery. So plasma is administered thousands of times a day in the hospital for different surgeries or when people have trauma. But you can take plasma and use it for different therapeutic aspects. And in this case, we are using young plasma, which is plasma from an 18 to 24-year-old donor that's matched by sex. So a female will get a female's plasma, a male will get a male's plasma to increase safety. So the young plasma essentially has all of those components, the proteins, the hormones, the exosomes, and the peptides from a young person. So you take somebody that's 40, 50, 60, 80, all of those components are going to be much older and not working as well. So it's essentially like an oil change for the body. So you're taking out the old and adding in new, and with that new comes decreased inflammation and the regenerative properties of that plasma.
So this is part of the advantages of it, right? It's regenerating younger plasma in our bodies. Is that the advantage of it?
Yes, and I'll have Tom speak about that, and he can talk about some of the experiences he's had with it.
Yeah.
Yeah, hi there.
Hey, Tom.
Good. In 2019, Stanford mapped the plasma proteome. It's now up to 100,000 people. And our plasma changes so much as we age, it actually controls our aging. Harvard last year said biology is 99% software, that is the plasma, and our cells and tissues are the hardware that respond to the signals in the plasma. But those signals change profoundly as we age, to the point they can pull plasma out of you and tell you how old you are to an accuracy of 3 years, which means when you're 25 and you're 28, your plasma is distinctly different. So that controls our aging process. As part of that aging process, we reach a biologic peak between the ages of 18 and 25. So that's our purpose in living, is to reproduce. After that, we become less useful. So at the age of 26, we start falling into a dormancy controlled by our plasma. Stanford mapped it that your first real dip is at the age of 34. Your next one is at the age of 60. And your last one is at the age of 78. I'm 72, so I'm biohacking myself because the original studies found that if you take plasma from a different age and put it into yourself, your cells will respond to the age profile of the plasma. So I'm 72 and nobody wants my plasma because if I put my plasma in an 18-year-old, all of the cells in their body will think they're 72. So I'm putting plasma right now into me from an 18 to 25-year-old. And as Dr. Gallegos says, sex identified, because we have 50 hormones, each are sex specific. And the plasma profile itself changes very profoundly between men and women. But quite simply, we're programmed to age, and I am biohacking my age by putting into my circulatory system plasma from an 18 to 25-year-old donor. And all the cells in my body, I'm doing 3 liters. I've been doing it over 2 days, and we have 5 liters in our blood supply, and roughly 3 liters of that is plasma. So I'm over 2 days putting 3 liters of young plasma into me to biohack my aging. And as you may notice, I also put it on my
Oh,
face
oh.
because
So
the
you already
molecule,
have the plasma injected.
yes, you run it intravenously, but if you want to do something localized, because the molecules are too big to rub in, you can't rub them in. So you have to make little micro punctures and then you rub it in through those punctures. Another technique is if you have orthopedic pain, you can put it in a syringe and then target its injections. So it's very versatile. Now, plasma will influence every cell in your body, so it is not disease specific. It goes to every single cell from your brain to your bones to your skin to your eyes. So it's more volume related. And as we age, of course, most diseases are age related. So we all remember when we were 18, and even if you had an injury, you would heal very, very quickly.
Correct.
At my age, not so much. And so what happens when you put the young plasma in you, it's very complex and it's biopreserved, but quite simply, all the cells in my body now think I'm 21 and they start
How long before
regenerating.
you feel the difference?
It,
So you're
it
gonna.
happens
It takes time.
immediately.
It
It's
happens
this,
immediately.
it's a signal. So it's like changing the channel from a, black and white to color program. It happens immediately. Now you notice the sleep improvement, you notice libido improvements very quickly, but within 5 to 7 to 14 days, you really notice it. And we've seen this in our studies as well, but you get energy, you get balance, you get strength, but it's every cell in your body. So we've even seen conditions such as Parkinson's and Alzheimer's, and diabetes is extremely responsive to the plasma, type 2 diabetes. So again, we're not treating a diabetic with plasma. The
Correct.
plasma is going in and treating all their cells, with which then their own natural production of insulin improves, their A1C lowers, or in the case of Parkinson's and Alzheimer's patients, we're restoring into their brain proteins that their body no longer produces, and that allows them to recover. Because, I mean, right now, my body hasn't seen this profile of plasma in 50 years. And so, but it's like simply changing the signal. And so my body is now immediately responding to this. You know,
How do you determine the dose per patient, per person?
So here, the dose is determined based on the condition of the patient and their comorbidities, the size of the patient. So typically, we try to shoot for 3 liters, and that was based on. So there's a current investigational study being conducted here in Houston with plasma. So based on the data, 3 liters seems to be the sweet spot for the initial infusion, but you still will get benefit from 1 to 2 liters. And we determine the dosage. So if somebody has heart failure, we're not going to load them up with 3 liters. We're going to do it very slowly over time. So there's different approaches that you can take depending on how suitable a person is for receiving the plasma. So we don't want to run it in too quick on certain people. Or if you have a little old lady that's very frail, you would take your time in infusing it. But the dosage seems to be about 3 liters for the optimal effects of the
Is there
plasma.
any current alternative therapies that is similar to this? Nothing.
No, because what happens is, and it's very common in the medical industry, you can't own plasma. It's a natural biologic. So people then create derivatives, individual molecules, such as exosomes. That's a signaling molecule. Some of the pharmaceutical companies take individual plasma proteins, such as immunoglobulins,
Correct.
and then they create IVIG, which is itself a $10 billion product. But what happens is, this is a very complex formula. So they're doing that because they can own it and they can make money. But to send just exosomes into a person, you're signaling possibly that it should start regenerating. But the problem is, you need the proteins, you need the peptides, you need the cytokines, you need the hormones to act on that signal. So selling individual peptides like GDF11 or selling some plasma proteins individually, there are 10,500 proteins in this plasma right now.
Right.
There are 5,000 peptides. There are 50 sex-specific hormones. So we underestimate Mother Nature as we try to make a profit, but really the best approach is to take it from someone at their peak of performance in life and then biohack myself with that plasma. And so that's the opportunity we have here in Houston. I'm the only blood bank in the world that is exclusively collecting plasma from 18 to 25-year-olds. We do it at Texas State University. And I'm the only blood bank in the world that identifies the sex, because we know men and women are very different. And it's very important that women receive plasma from a woman and men receive plasma from a man. Although you go to MD Anderson or any hospital, they'll give you a blood type, but they won't tell you about the donor. So we're very unique, and it's very, very important. But it's a complex problem. The plasma is intact, fully as nature and God intended it to be, and I'm simply putting into me, and it has everything, has the exosomes, it can send the signal, but it has the proteins, the hormones, the peptides to realize that regenerative benefit from that signal. And so it's the whole package, and to do anything less is not going to be nearly as efficacious.
This is an expensive treatment. So how frequently a person needs to do it? If I'm gonna give my body this dose, number one, how long would it last, and how often do I need to do it?
Very, very good questions. And it's expensive, but it's 1/10 the price of pharmaceutical derived plasma products or exosomes. So really the process itself, because there's an extensive amount of testing and health examinations that go into the donor before we accept their process. I've been doing this for 8 years. I have been doing it once a year. We found originally at Stanford University with their Parkinson's patients that the benefits lasted 2 years. We're finding with some of the diabetics that they receive one treatment and they're continuing to benefit with normal insulin and A1C for 4.5 years so far, and they haven't returned back. So it's lasts much, much longer. So I've been doing it a year. I mean, quite frankly, I would do it every 6 months if I could, because you so feel the energy, you so feel it that your body starts talking to you a little bit and says, I'll take a little bit more. So your point is correct. It's more money related, the expense, than it is the opportunity, because your body would say, forget about what I'm giving you. Let me just have this. And, that would be the perfect state. But I've been doing it a year. If I may consider every 6 months, but given that it lasts, it has a duration, and like Dr. Gallegos says, I'm receiving 3 liters in 2 days because I'm traveling. I live in California. If I was here in Houston, you could come by and get, 400 mLs once a month. And at the end of the year, it accumulates because it has a great duration. So in essence, the volume you get is essential because you're replacing proteins in a profile your body doesn't have anymore. So it's more the price, because you can go slowly and have it benefit you and it will accumulate over time. Or if you're a traveler, then you come in and do it very quickly and then just receive those benefits and then come back in a year or come back in 6 months. And that would be a very good regimen.
So is it like a blood transfusion? When people receive a blood transfusion, they get a reaction at the beginning. Is there any reaction that the body will have towards this treatment? The
Yes,
first day, 2 days?
as you pointed out, anytime that you're infusing anything into the body, you can have some type of reaction. The most common reaction is an itchiness or hives. We pre-treat that with histamine blockers ahead of time, so some Benadryl and Pepcid, and those symptoms are usually very, very minimal. Um, and as Tom was talking about with the male and female sexing of the plasma, that also reduces any reaction that might occur. The other reaction is system overload. We're putting in 2 to 3 liters of more volume into the system. So the way that we prevent that is we either have the client go donate plasma themselves ahead of time, or we take whole blood out while they're here in clinic. So depending on if they're anemic, then we'll shoot more for the plasma to be removed just to make space. If they have plenty of red cells, then we'll just take the whole blood out, and that allows for the volume replacement and expansion without any risk of any overloading of the circulatory system.
I see. So what is the process of getting this donation on preparing the plasma?
Yeah, I'll speak to that, but it's also very important to appreciate that plasma has no cells. So when you donate blood, it's a little bit debilitating. So you can only donate blood 6 times a year.
Correct.
Plasma reconstitutes in 48 hours. Legally in the United States, you can collect it 104 times a year. We do half that because we measure, getting to your question about donors, we measure their plasma proteins before they make a donation. Plus, they have to go through a complete health examination before they make a donation. And then their donation is tested very, very extensively because our blood supply has been safe since the year 2000 because all pathogens can be detected. And we use up to 10,000 units of plasma a day in the United States. And all of that is documented on safety records. These people are concerned. COVID, for instance, does not travel in plasma. And we've, since COVID broke out, we do approximately 2 million people a year with transfusions with plasma. And so the record of safety is extraordinary because they'll do 2 million people a year. And the last fatality they had was one individual, which was a man that had received plasma from a woman that doesn't go through the testing that we perform. So we perform more tests than any blood bank. The FDA has called us the finest blood bank they have ever seen because we go above and beyond, because we're not in surgery. We're not trying to save someone's life. We're trying to prolong someone's life. So we do things that ordinary blood banks don't deem necessary just to do that extra measure. But all our donors are very healthy college students, and each one, every single time, must pass a health exam, must pass a protein profile, and then they must have their plasma tested before we release it.
Is there now on the receiver? Is there an age restriction to who would receive blood plasma? Is there a certain age? I think Tom said at the beginning above certain ages that they can do this treatment.
Well, what we find is, of course, the older you are, the more your body appreciates the plasma. So the window we're collecting from is 18 to 25. And even though you start aging at 26, it's not really appreciable until you're 34. But and then you've got a long ride before you hit 60. But we find really people in their mid 40s is probably a good starting point, because the philosophy is don't allow yourself to become damaged and then repair yourself. But if you can keep yourself at a youthful level, then a lot of these age-related diseases would be avoided.
Nice.
So I'm old, so it benefits me dramatically.
Okay. Thank you for the answers. I'm trying to see what else I have in my plans to ask. We're talking
So
about
Abir, what he
yeah.
was referencing on the young plasma facial is using the skin pen, which some of
Mm-hmm.
your viewers might be familiar with, the so-called vampire
Yeah,
facial.
they used to
So,
use the PRP and all this.
yeah,
I
same
guess
exact
PRP is
process.
old-fashioned now.
Let me talk to that. Yeah, it's old fashioned, but also keep in mind that platelets are a blood cell and their purpose is clotting. So, really, when you use PRP, what you're doing is you're creating an injury and then you're putting in a clotting factor to heal that injury. When you use young plasma, you're not injuring someone. What you're doing is introducing a regenerative effect. So it is much more effective. And of course, the older you get, the less viable your platelets are. And so you have that as a factor as well. So anywhere PRP is used, all of those procedures would benefit from using young plasma, because again, you're not relying on the healing of an injury. What you're doing is you're introducing regeneration and the complete package, the exosomes and the proteins and everything you need to regenerate. So even hair restoration, joint injections, or the facial I'm receiving. And again, you have to do the puncture because some of the molecules are too big just to rub through your skin. But this will clear up in a couple days because it's very superficial. But then my skin will start regenerating. And it's kind of a complement, to do targeting if you want.
Mm-hmm.
Although the IV itself will get to my skin as well.
Right, inside out.
Yeah, inside out, exactly.
Wonderful. This is such a beautiful treatment. And I know people look for wellness ways to stay healthy. Of course, this has to come with a healthy lifestyle. We will not forget about the basics that we need to do after we do such treatment, correct?
Yes, absolutely. That's always the case. And as we've spoken before, you have to have that solid base of proper nutrition, optimal sleep, mindfulness, healthy mental fitness, mental health, and then also proper movement as well. So all of those are the base, and then you can add in all these layers. But this is one therapy that you can add that augments that significantly.
Beautiful, beautiful. This is such a brainstorming about such a new therapy. I've been listening and searching about it for a while until you said you're going to start to present it in ثرايڤ Medicine in Houston. And we really appreciate that you're starting such a center. I want to say that Dr. Philip has a wellness center that has so many different levels of therapeutic wellness, including IV treatments, hyperbaric oxygen, red lights, and on top of that, now we're going to have the young blood transfusion, which is really, I'm very proud that we have this in Houston. Houston is such a rich city in medicine and in researcher, and it is really deserving to have such a center in Houston, looking for the wellness of patients. And I always say, and you always support me with that, we don't need to wait until we get sick.
Absolutely.
This is something very important. We always wait until we get sick, then we go to start to rescue ourselves. But when we're not sick, we still can come to a center like yours and help ourselves to stay unsick as long as we can. Am I correct? Can you talk about how you can support yourself, continue to be healthy?
Absolutely. So we want to take a preventative approach, and this is where standard medical practice doesn't really focus on wellness and healthcare. They mostly are reactionary and focus on really sick care. But we need to flip that paradigm and really focus on one, preventing ourselves from ever getting sick. And then if you're healthy, let's optimize that healthiness, always working on some aspect of our health, whether it's our flexibility, mobility, trying to prevent us from getting frail as we age, working on our mental health, mental fitness, so we're strong and resilient, working on our diet, nutrition, so that we're getting all of the nutrients that we need for our body to function at its optimal level. And then if you have the means, then you can do all of these other fancy things that are available to really get you functioning at peak performance. So just like an athlete invests in all these aspects to improve their performance by 1-2% so that they can win the gold, same thing. You're trying to be the best mom you can be, the best husband you can be, the best entrepreneur. So having a clear mind, having your mobility, flexibility, strength, all of the energy, all of these things are important so that we can function and show up as the best versions of ourselves. And so adding these therapies help us achieve that goal.
Thank you. Thank you. I really appreciate this video, and I want to visit with you more often because there's tons of things that I want to talk to you about. Unfortunately, Instagram will not post my video if it exceeded 30 minutes. So I want to keep it within the 30 minutes so we can keep it on my page. But I would love to visit with you more about it. I would love to visit with Tom later more about how is he feeling after his therapy. So we would love to have a live with him again when he comes to get his second dose and listen more to how did he feel after he got his therapy. Is it his first time or is it
He's done it multiple times, but yes, we will absolutely revisit this. How much more time do we have?
I think we have 10 more, maybe 7 more minutes.
Okay. I'm going to have Hananda talk about how you would be able to receive this therapy living abroad or anywhere in the United States.
Yes, very important. I'd love to. Hello, hello. Nice
Hi,
to meet you.
it's really lovely to meet you too. I have been very fortunate, to work with these guys at ثرايڤ here in Houston. but I've also been very fortunate to be the recipient of the Young Plasma as well on several occasions and in several different formats, like Tom mentioned. And one of the things I love about working with these guys at Thrive is that really from a really practical point of view, Houston's got easy access, international airports. And while the Young Plasma is only available in Texas, one of the areas that I'm really loving working in is that I'm working with Dr. Gallegos and Dr. Langley here at Thrive to open up a channel to make Young Plasma more readily available. And one of the reasons that I'm choosing to work with these fellows is because I've been to many rejuvenation clinics, and I'm very blessed. I get to have fantastic conversations with fantastic people doing fantastic work in the world. The thing that's really impressed with me about them is their level of care. And it's a beautiful clinic. I don't know if you've seen around the
Yes, of
place yet,
course.
but if you haven't,
Yeah.
make a point of it. But it is the level of concierge service, and that's really inspired me and Spectrum Plasma to open up a channel to people coming in from overseas. Every week, I get at least a couple of inquiries from people overseas. They want us to ship plasma to them. It's
So is
not
this
physically.
possible? Is this
It,
feasible? And I like to talk more about that.
yeah, absolutely. So it's not possible for us due to regulatory limitations. We're not able to ship it out of state, which is why I am really appreciating the fact this. I mean, this therapy can change lives. So if we're all entrepreneurs here. So if we can't ship it out of state, how can we make it really, really easy for people to access the product so they can come into
Right.
an easily travelable international airport.
Mhm.
They can get concierge service. And again, one of the areas that Dr. Gallegos and Dr. Zangelis have really impressed me is that they really roll out the red carpet. Because as you said, it's not an inexpensive product. And what they've turned it into is as an experience. So if people need help with transportation or reservations at the best local restaurant in town, or really want a Texas experience, then they
Well,
are
Houston is highly visited by for so many reasons, for medicine, for business travel, for leisure travel. So so yes, of course, it will be accessible for a person visiting in Texas to receive this treatment, but we're not going to be able to ship. I want to make this clear. We cannot be able, but we can arrange appointments and we can make it in and out in no time
exactly.
for someone who's interested to receive the treatment. Great.
Absolutely. So yes,
Very
there's limitations on our ability to ship it, and so we've reverse engineered that to find solutions that make it really easy. You can be in town on one of the countless conventions in town, and you
absolutely
can swing by Thrive, and they will figure out how to make it the best experience with the time and the budget that you have.
beautiful, beautiful. Thank you so much. I
My
really
pleasure.
trust their services. The doctors are really a very upscale, and I really enjoy the center. I'm a regular visitor to the center, and I appreciate it so much. I've been waiting for it to open for some time, and I was really excited when it did. So yes, I know that for our patients who are or the people who or candidates who's really interested, they can get in touch with us, and I will my team ourselves we will make sure to coordinate an appointment for the transfusion with you. So is there any lab testing they need to do prior? If someone like decided they're gonna want the transfusion, what is the preparation that you wanna have before?
So there are some lab tests that we will have them go get prior to the infusion. Then we also talk about either the plasma donation or the blood donation ahead of time, depending on what those labs reveal. And then
How
those are the
long
things.
does the lab test result takes? Just so I can think of what is a round trip of doing this with
Usually
you.
takes a week or so to get the lab results back.
Oh, okay.
So 3 to 5
Okay.
days.
Okay.
And then the blood donation's quick. We can either do it here in the office or we can send them to
What
a
is
center.
the blood donation? I'm not
So,
sure. I'm clear about blood
so
donation.
we either take out 500 mLs, which is half a liter of whole blood, or we send them to a center to have plasma removed, which can be either 1 or 2 donations depending on how long
Of
they're in town
full
for.
blood.
So they remove the plasma and give you back your platelets and your red cells.
Oh, okay.
If you do that.
And why is that? Why is this
So,
tip?
so we're creating volume. Since you're going to be putting in 2 to 3 liters of volume, you need to take some volume out so that you don't overload the patient with volume.
Okay, so why don't I just go and donate blood?
Yeah, you can. So you're doing
enough.
something. You're doing something good for the community, and you're making room for your new plasma that you're receiving. That's what we encourage people to do, because they're doing something good and they're allowing for room in their circulatory system to receive this therapy.
Of course. All right. Thank you for clarifying this. All right. So it can be a week length worth of treatment, just because the lab test takes some time for results.
Well, and we can even get the labs internationally. So we
Ahead
can
of
send
time.
the list of labs. They can have their doctors run those labs and then just send them over to us. So with this day and age, like we're doing this Zoom, or I mean this IG Live, we can do a Zoom call and do a consultation and then get the labs done that way.
Anything to save time for someone who's traveling international will be helpful.
Yeah, absolutely.
Okay. All right. Well, thank you so much for your time. I really appreciate it.
Thank you.
And looking
for
forward
hosting us.
for our next video. So we need to agree on the next one very soon.
Absolutely. And then when you're back in town, come see us.
I will. For sure. Thank you so much.
All right. Take care.
Have a good
Bye-bye.
day. Bye-bye.